JAISWAL from University of Perpetual Health System Delta. Today we are going to test the sensory system. To evaluate the sensory system, we will test several kind of sensation. First is pain and temperature, position and vibration, light and touch, and discriminative sensation. The pain sensation, use a soft safety pin, cotton swab or other suitable tool. Occasionally stable blunt end for the point. Ask the patient, is this a sharp or dull, or when making comparison, does this feel the same? And apply the lightest pressure needed for the stimulus to feel sharp, and try not to draw blood. Touch with a fine wisp of cotton, touch the skin lightly, avoiding pressure. Ask the patient to respond whenever a touch is felt, and compare one area with another. Callous skin is normally relative insensitive and should be avoided. To check the temperature sensation, we are going to use the tuning fork. We will touch the skin and ask the patient to identify if it feels cold. We have to use a tuning fork of Hertz 128 Hz and tap it on the heel of your hand at the place it firmly over the distal interpharyngeal joint and patient fingers, then over the interpharyngeal joint of the big toe, and ask the patient if he feels the vibration or not. Option or position, grasp the patient's big toe, holding it by its sides between your thumb and index finger, and then pull it away from the other toes. This prevents extraneous tactile stimuli from affecting position. Testing, demonstrate up and down as you move patient's toe clearly upward and downward. Then with the patient eye closed, ask for response up down with the moving large toe in small arc. The discriminative sensation, we will start with the strychnosis. Strychnosis refers to the ability to identify an object by feeling it. Now we are going to place some familiar objects in the hand of the patient and will ask them to recognize it with his eyes closed. Number identification, when of motor impairment, arthritis or other conditions are prevent the patient from manipulating an object well enough to identify, test the ability of identify numbers with the blunt end of the pen or pencil. Draw a large number in the patient's arm. A normal person can identify most such numbers. Now to point discrimination, using two ends of open paper clip or side of two pins touching a finger pad on place the stimulus. Simultaneously alternate the double stimulus irregularly with one point touch. Be careful not to cause pain. And this is SWATI JAISWAL from University of Perpetual Health System Delta, and today we are going to do the deep tendon reflex. And for deep tendon reflex, we will start with the bicep reflex. The bicep reflex, the patient arm should be partially flexed at the elbow with palm down. Place your thumb or finger firmly on the biceps tendon and strike with reflex hammer so that blow and aim directly through the digit towards the bicep tendon. For the triceps reflex, the patient may be sitting or supine. Flex the patient's arm on elbow, palm towards the body and pull it slightly across the chest. Strike the tricep tendon above the elbow. Use a direction blow from directly behind it. Watch for the contraction of tricep muscles and extension at the elbow. Or brachiodialis reflex, the patient hand should be rest on the abdomen or the lap with the forearm partly pronated, and strike the radius with the point or flat edge of the reflex hammer about 1 to 2 inches above the wrist. Watch for the flexion and supination of the forearm. Flex, the patient may be either sitting or lying down. As long as the knee is flexed, briskly tap the patellar tendon just below the patella. Note concentration of quadriceps with extension at the knee. A hand on the patient's anterior thigh lets you feel the reflex. Ankle reflex, if the patient is sitting, dorsiflex the foot and the ankle press to it. The patient to relax, strike the Achilles tendon, watch and feel the plantar flexion of the ankle. Note also the speed and relaxation after muscle contraction.